introducing you today to Kelly Mondesire. Kelly is trained. That's what I want to say. Kelly's trained in traditional Chinese medicine and including acupuncture. And today what we'll be talking about is really about stress management, but we're going to take kind of two approaches. And Kelly's going to be talking about the first approach, which is having an advocate. And the second is looking at acupuncture for stress management. So, Kelly, welcome.
Thank you, Denise. Thank you for having me. Understandably, when one is diagnosed with cancer, particularly breast cancer, not only is it a shock in most cases, but also for women, it's just devastating because they're thinking about their breasts, and many women identify with their breasts, and they're concerned about, am I going to have to be pushed into menopause? What's going to happen? What is my life going to be like? What is life during this journey? Am I going to live? What's going on? And stress just becomes insurmountable. And so I always stress to my patients that have been diagnosed with breast cancer how important it is to have a good patient advocate. And a good patient advocate can be a friend, a relative, a colleague, but also someone who is trained at patient advocacy. And this is the person who can take you through all the different stages from your first appointment at the oncologist to your treatment protocol, introduce you to dietitians, other practitioners who can help you through this journey and guide you step by step so that your stress level is such that all you need to do is focus on getting healthy and fighting this cancer and making it through the finish line to living a long and healthy life.
Some people think that that stress is normal. They think that their going rate, you know, they're not stressed, but in fact, it's so normal that they don't even know that it's there. But we do. They've done those studies where they've actually looked at the MRI of people. They were looking for chemo brain really changes, and they found it straight away at the time of surgery. And I'm thinking that all the lights came on in the MRI, and I'm sure that was really a record of stress.
I wouldn't doubt it, Denise. I'm in Manhattan, and in Manhattan, stress is the old norm. Stress is, everyone walking around in Manhattan, it seems, is totally stressed. They don't acknowledge that they are stressed, and it's a normal state of being for them. And what stress does is stress really affects the adrenals and the sympathetic nervous system. So someone who is stressed is in a heightened state of fight or flight. Someone who is stressed is in a heightened state of the blood pressure being raised, the body temperature being raised, and also drags down the immune system. Because when a person is in a stressful state of being, their immune system is running at top speed and at fifth gear. And if you have something like cancer, the last thing you want to do is have your immune system wasting its time and valuable cells fighting stress instead of fighting the cancer cells.
So Kelly, you're talking about finding someone that will be a patient advocate. Can you just unpack that a little bit? Where we've got a surgeon, there's going to be an oncologist, there's going to be a nurse, there's going to be maybe a partner and family. Tell us what is different about an advocate.
A patient advocate is someone, and I know a few professional patient advocates here in the New York City area. A patient advocate is someone who is going to impassionately or dispassionately go to all these different meetings with the oncologist, the surgeon, the dietitian, the attorneys in some cases where a person needs to get their affairs in order prior to embarking on surgery, say. Someone who is dispassionate, who can go with an objective state of mind, with a set agenda. Here are the questions we need to ask. Here are the questions we need to have answered. What is the protocol? What is the treatment course? Are we going to have a second opinion here? What what is the journey? What is the protocol going forward? Who are we going to see? And someone who is going to say, hey, I'm your coach. I'm going to interpret what the oncologist or the surgeon says and break it down for you in normal language or everyday language so you can understand what you're dealing with, what are your options, what are treatment options, and going forward what this might look like in the future. This was someone who is very, very well versed in the different treatment strategies that are out there, who knows which surgeon or oncologist might be best appropriate for this patient. There's also such a thing as, you know, I'm not feeling comfortable with my oncologist, but this is the person that was recommended to me. If the relationship is not comfortable for the patient, there should be other options. And that's what a patient advocate is there for, to allow the patient the breathing room to sit back and think about what their options are, what their treatment strategy is, and give them some good choices going forward of, okay, you can take this route, these are the positives and negatives of taking this direction, or these are the positives and negatives of going in a different type of direction.
Kelly, I see that with medicine, the changes over the last couple of years, where people are being asked to make even more decisions up very, very soon after the diagnosis, and one of those would be breast reconstruction immediately. So this is another example of needing someone to gather that information, listen to that information.
Absolutely. And sometimes, look, it's not a race. It's not a race to have breast reconstruction. Some women choose ultimately not to have breast reconstruction. They would just rather just have their bodies be as they are, and that's their choice, that's the decision. But it's just such a whirlwind of events for surgery, chemo, radiation, maybe aromatase inhibitors, the side effects that come with treatment. Sometimes it's needed to take a step back, and again, a reconstructive surgeon is one who should be interviewed as any other surgeon, feel that the patient is comfortable with that surgeon, what are their options, when should they have the surgery. And again, this is where the patient advocate comes into play and is a very, very important piece of the patient's life, because again, they should have options. Okay, here's option 1, here's option 2, here's option 3. What do you want to do? What would you like to see? Is it necessary to have this done right away? What are the positives and negatives of having reconstructive surgery just after a mastectomy, or do you want to wait 6 months? Do you want to wait a year? Is that an option at all? So it's an obtuse answer, I know, to your question, but there are so many parameters involved, and again, this is why you do have a patient advocate.
Well, it sounds to me, Kelly, a very clear difference between a family member, a very close family member, who is probably just as stressed and emotionally attached. What you're talking about is very clear. Having someone that is not emotionally attached to
Correct.
in their brain, so that you're really using someone else's brain to help you make the decision.
Yes, and that's why I use the word dispassionate and objective, because emotions cannot come into the picture here. If someone is lucky enough to have a family member or a friend who can complete this task, yes, indeed, they're very lucky if someone can do that research for them and act as a patient advocate. Otherwise, cost is a factor for most patients. Which is a shame. Most of the hospitals that I know of here in New York City, they used to have a dedicated organization where they would have patient advocates who would come in on a volunteer basis, who were either nurse practitioners or other professionals that were up for this responsibility, who were up to take on this task for women who couldn't afford nor had a patient advocate that they could rely on and lean on during this phase of their lives. There are a few organizations that will provide a patient advocate, but in most cases, I'm finding that patients are falling through the cracks. They're diagnosed with cancer, breast cancer, and they're in a tizzy because they just don't know what the next stage is, and there's no one there to guide them. And my first question to them is, were you assigned a patient advocate? And I'll tell you, Denise, in the last 5 years, 99.9% were saying no. They were saying absolutely no, or they were saying, well, I'm supposed to meet with a nurse practitioner in another month. Well, that's 4 weeks of valuable time gone by to discuss treatment, to discuss protocols, to discuss even if this is the right strategy. In some cases, a surgeon from one hospital or an oncologist from one hospital has a different philosophy of treatment than another set of physicians from a different hospital. So that 1 month that could go by is an invaluable amount of time where these decisions should be made and the research should be made into this patient's particular case.
So Kelly, you're actually bringing up a point about availability, cost, and models of care. And I think that for the summit, we're not answering these questions because they're so different in each town, each country. But what we're doing is highlighting the importance of. Don't think it's unimportant.
Absolutely. You know, this is to any patient, I would say, this is your life, and you have to take control in some way over what's happening with your life. Cancer is not going to rule your life. You are going to rule the cancer. But with that, you need help, and you need someone who can help you, who will know what avenues to walk you down, what types of questions to ask is very, very important. You can't go blind into this. And because it tends to be such an emotional and nerve-wracking experience, you need someone who is objective. And again, I'll say this word, dispassionate, who can be very frank with you and lead you to making the proper decisions for your life. This is your life.
Thanks, Kelly. Let's move on to your second part of the stress management, which is using acupuncture. Can you tell us more about that, please, Kelly?
Yes, of course. My role in all this is to possibly find a patient advocate for my patient that walks in with a diagnosis of breast cancer. And my job is to de-stress them. Stress builds up congestion and stagnation in the body. And when a person is stressed, it's not good. It affects their sleep, it affects their appetite, their digestion, and it affects the immune system. So what acupuncture can do is help relax the individual, to help reduce the heat building up in the body. It can help to get that person's sympathetic fight or flight reaction to just calm down. And by gentle treatment, we can achieve those results. And while the patient is undergoing pre-op procedures, post-operative procedures, and chemotherapy, we can step in as acupuncturists and deal with all the different conditions that arise, whether it's hair loss, stress over hair loss, or mouth sores, pelvic floor dysfunction, digestive dysfunction, xerostoma or mouth dryness. All this builds up stress. A breast cancer patient, for example, that's on aromatase inhibitors, they're having hot flushes more or less during the day, or they're having joint pain per se. Well, that adds more stress. More stress adds heat, irritability, insomnia. So what we do is we go in and we try to alleviate many of those symptoms that they're experiencing with their different treatments and side effects of those treatments. And that's where we come into play. If you can get a patient to be calm, stress less, or stress-free, or less stressed, dollars to donuts, they're going to have fewer hot flushes. They're going to be able to manage their treatments much better. they're going to sleep much better, their digestion is going to be much better, and they'll be able to build up their immune system to fight off the cancer.
So Kelly, you're talking about acupuncture, and there's some great research out there if people want to go looking for it. Can you tell us just a little bit more about the mechanism of acupuncture?
Yes, of course. The brain is like the black box of a computer, and we're all body electric. When you get down to it, we're all nothing but protons, neutrons, electrons. Those make atoms, a bunch of atoms create molecules, molecules create amino acids, proteins, and these are the building blocks of the human body. So that being said, if you look at the acupuncture meridian system, it's almost like a matrix system. And these different acupuncture points are almost like websites along the matrix system. And each point can send a signal, an electrical signal, to the brain, which is the black box, that, oh, hey, my adrenals are working overtime, and there's a sympathetic nervous reaction here, and the heart rate is going up, the blood pressure is going up because of stress. The brain, being as smart as it is, will send out in forms of neurotransmitters, hormones, white blood cells, red blood cells throughout the body to alleviate those symptoms in the body, and will act upon their adrenals to calm down the sympathetic nervous system in the case of stress, and relieve the person's symptoms.
So Kelly, you talk about and there's kind of like two mechanisms. One is like, let's just say the brain is lighting up, so there's like lots and lots of activity, but then you talk about congestion. So it's quite a complicated business. So I think that probably where I'm driving this to is that you make it sound easy, Kelly. You've done.
I try to, for the general public, I try to simplify as best as I can, so there is an understanding of what's happening. But let me digress a little bit more into qi stagnation or congestion. When a person is uptight or stressed, okay, you have the sympathetic nervous system kicking in. In Chinese medicine, this leads to stagnation of qi. It stagnates the free flow of energy. The blood doesn't course through the veins properly. The cellular nutrition doesn't get to the different organs, the connective tissue, the muscles properly, because there's this signal that the white blood cells, the neurotransmitters, and the hormones need to go in a different direction for the sympathetic nervous system. So what acupuncture can actually do is redirect the energy, redirect the fluids in the body, redirect the neurotransmitters in the body vis-a-vis the brain or the central nervous system, to smooth out the flow of energy, smooth out the blood circulation, smooth out the hormonal diversification through the body, so that the person's heart rate will go down, the blood pressure will come back down to normal, they'll feel calmer, and the flow of the qi, or the vital energy that we call in Chinese medicine, can flow much more easily.
Thank you, Kelly. So if people are looking for some help on this line of care, then they can ask at their clinic. How would you suggest that people progress?
Well, very often, well, I can only speak for my area here in New York City. Very often, an oncologist or surgeon will not be giving them a recommendation for a patient advocate, or they'll send them to a department, some sort of department within the hospital. There are organizations out there that can help. One is Foundation 96, which is a non-for-profit. I'm sure you're familiar with Foundation 96. You can find that online, and this is a non-for-profit organization that lists practitioners worldwide who are trained to help the cancer patient. It's every practitioner, from an oncologist to a massage therapist to patient advocates. And this is one resource that patients have. I know the Mayo Clinic here in the United States is also a very nice plethora of information, a good resource of information. We also have something called Cancer Centers, Cancer Treatment of America here in the United States. These are to start with. American Cancer Society, for one, here in the United States is another resource for the cancer patient. It's tough. Things have changed here in New York City because of the mergers of the various different hospitals. So programs that were set in place, say 15 years ago, are no longer there. So it's tough. Each person in any sector of the world has to look for this information, perhaps using Google.
Thanks very much, Kelly. We've given 2 ways of managing stress. Thanks very much.
You're welcome. Thank you very much, Denise.